Today we're talking to Joe Doherty Jr., president of PhillyLabor.com, serving the Philadelphia area union community. Welcome, Joe. Thanks for coming on the show.
Glad to be here, Dr. Targan.
So tell us a little bit about how you got involved and what it exactly is that this group does.
Well, PhillyLabor.com is a media and PR platform serving the Philadelphia area labor movement, which is the Philadelphia area union community. We provide news, information, and announcements to the Philadelphia area labor movement, but we're also involved heavily in advocacy programs. One of those advocacy programs is the Injured Workers Advocacy Program for injured workers, for workers that were injured on the job. It's a passion, being an injured worker myself previously, understanding the challenges and the fears of being an injured worker. We felt like we want, PhillyLabor.com, we serve the needs of the labor movement and the workforce, but we also wanted to provide a program that would serve those who were injured while working, so we weren't leaving anybody behind. We're very excited about it and just glad to be here.
So prior you mentioned that you were injured yourself. Tell us a little bit about what happened to you and with those experiences, how that led you to doing what you're doing now.
As an iron worker, union iron worker out of Iron Workers Local 401, and we're working on the Frankfurt L, and we're bringing a large gate. Me and a couple co-workers were bringing a large gate down a long flight of stairs, and it cut loose, but I held on to it and went down the distance of the steps and tore my back up pretty badly. It was a very scary time for me and my family, of course, and the whole process, not really having many resources or kind of experienced people that were on my side that I could trust, available to myself. Understanding what that experience was about was really the inspiration for putting the Injured Workers Advocacy Program together.
Okay. Now, when you went through this process, how were the Iron Workers Union, how did they help you?
Well, the Iron Workers Union was great. I mean, they pointed me in the right direction as far as, an attorney and to the best of their ability. They procure work for members and they provide resources just like every other union to the best of their ability, but they're not in the workers' comp industry. Although, obviously we get, a lot of injured guys, unfortunately. But they did the best they could. Where I had the difficulty was just, with the company, with, the insurance company. Really it became pretty evident to me that they weren't really on my side, and it just, it's a little intimidating, when you're first of all, you're hurt. You're not used to being hurt, you're vulnerable, and now you're in a situation where, you're kind of alone. The union does the best they can, but again, you can't constantly call your business agent, for workers' comp advice. So understanding that and being in that position, I never really wanted anybody to ever experience what I went through, and that I know a lot of people are going through every day.
Sure.
So this is why we formulated this program, and we feel great about it.
So in terms of advocacy, you said that you're helping patients involved in these type of situations. What is it exactly that you guys offer to these types of people?
What we've done is the Injured Workers Advocacy Program is a comprehensive program. What we tried to do was create a program that would really help injured workers in every phase of the injured workers experience. From the intake, when somebody gets hurt on the job, go into our website at PhillyLabor.com. It takes you to the, in the main nav, it takes you right to the Injured Workers Advocacy page. It tells you, it gives you the information, it gives you the contact number and the email address. It's a hotline. So you contact the hotline, and we have an intake officer there that explains your rights. It gives you information. But also, as part of the intake, we've created a groundbreaking new program, which we're incredibly proud of, called the Gap Assistance Benefit. What that does is, during that period of time where a worker is injured, and by the time that they get their workers' compensation determination letter, which means whether they're going to get accepted for workers' comp or not initially, we provide a financial benefit. That financial benefit It comes into effect based upon an incident report and a doctor's report that yes, you were, an incident report from the job and a doctor's report, both confirming that you were injured on the job. Then, the intake directs you to the legal process and our medical network of all the top legal professionals and medical professionals that understand the worker's side. With the Injured Workers Advocacy Program, we created an educational element, working with educational institutions like Community College of Philadelphia, really, providing great educational job retraining programs. So if you can't go back to work in the line of business that you were just in, that you were injured in, you have an opportunity to retrain yourself, get a certificate, and restart.
Pond Lehocky. You can see it in their eyes and feel it in their handshake. There are many law firms in Philadelphia, but no one works harder for you. No one. They'll do more to get more for you by working smarter and never backing down. Unbreakable, unshakable. Pond Lehocky. Unmistakable.
Today I'm here with Thomas J. Giordano Jr., partner at Pond, Lehocky, Stern, and Giordano. He's the head of the Social Security Disability Department, where he focuses his practice exclusively on obtaining Social Security disability benefits for disabled individuals. Thanks for joining us today.
Thank you, Doctor.
So tell us a little bit about what your role is and what you do.
So I'm a Social Security disability attorney. And as we were speaking off camera earlier today about Social Security, we were talking about retirement. A lot of people know about Social Security retirement, but they don't realize that they're also paying in to Social Security disability. Every time a Social Security tax gets taken out of you or I's paycheck, it's going into the Social Security fund. And I specialize in getting people disability benefits. And what that means is if you're unable to work for any reason, and I know today we're talking about workers' compensation, so we'll keep it to that, but if you got a disease process or you got injured at home or injured in a car or injured at work and you're unable to get back to work, you always should be thinking about Social Security disability benefits.
Now, if you do get these benefits, are you able to work after a certain time period, or you get this knowing that you're not going back to work?
Well, I think that's probably one of the biggest misconceptions about Social Security disability. People think that if you apply for disability, you'll never work again. It's quite frankly not true. They also think they're going to be walking around with maybe a scarlet letter of disability on their chest. Again, it's not true. If you're out of work or you're earning less than $10.50 a month in wages, you can apply for Social Security disability. And you can be on Social Security disability for the rest of your life, or you can go back to work if you're feeling up to it. In fact, the Social Security Administration gives you incentives to try to get back to work. So it's definitely not a permanent system. It's definitely not a temporary. It's really as long as you need it, as long as you're out of work.
If you're injured at work and you go to your Human Resources Department, they tell you to go through workman's comp.
Correct.
So you go through this long process. You get a physician, they set you up with a law firm. Where do they find you in that realm?
So, and I hate to say it this way, but any good workers' compensation law firm will always be thinking potentially about Social Security disability for their client. Obviously, the goal for the injured worker is always to return back to work as fast as possible, because you don't want to be out of work. You need to work. You need to earn money. But situations happen, circumstances happen where you can't get back to work. So your workers' comp attorney should be thinking about Social Security disability. If you've been out of work, let's say there's no set time, but over 3 to 6 months, that's when you really should start thinking about it. If you don't anticipate yourself getting back to work, you should consider Social Security disability.
Okay. Now, when you do go through the workman's compensation,
Right.
Where in the process do you fit in?
So at our law firm, at Pond, Lehocky, Stern, Giordano, the attorneys have almost like a checklist system, an internal tickler that'll tell us when it's time to start considering disability based upon how long our client's been out of work. So you asked, when do we start? We generally about 3 months out, we'll start thinking about it. It's a good strategy. It's a good a plan for our client, because sometimes workers' compensation is not going to be enough. And if our client's not getting back to work, why not apply for Social Security disability benefits? It's an additional benefit that they may receive.
Is it necessary to hire an attorney, or could you do this on your own?
You can do this on your own, and our office is an office that we would never tell you can't. What I've learned from my experience, my 9 years of doing Social Security work, is that a lot of people don't want to do it on their own because there's a lot of paperwork involved. So I always give people the option, and about 85% of the time they call me anyway and say, look, the forms were too much, we'd just rather you do it.
Okay. Now you specialize in this, but do
Correct.
workman's comp lawyers, attorneys, do this as well, or they just have someone like you do it?
It's a good question. We do get referrals from other workers' compensation lawyers in the area. Our office, we specialize in workers' compensation and Social Security disability. Some workers' comp attorneys, I do believe, practice both. We like to think that it's such a specialized area of the law, very much like medicine, where if I have a heart problem, I may not go to a podiatrist for that, I'd go to a heart specialist. Well, you might want to go to a Social Security specialist to deal with a Social Security issue.
Today I'm here with Dr. Ray Abdullah. He is a chiropractic physician who specializes in rehabilitation of injured workers. Thanks for coming with us today.
My pleasure, David. Thanks for having me.
So what is the role of a chiropractic physician?
What we do in our office, my office is focused mainly on the injured worker. We treat patients or workers who have been injured on the job. And when they come in, we do an evaluation, we do a consultation for the patient. We see what the best form of treatment would be for this patient. If they're in an acute phase, they definitely need some type of pain control. And my office is, we specialize in physical rehabilitation. At the same time, we have affiliations with different providers, different disciplines and specialties that we can refer out to, in particular pain management. When somebody gets injured physically, the intensity of pain could be extremely high. And we always have to find some techniques that would bring their pain level down so we can go ahead and proceed with the physical rehabilitation portion of the care.
So as an example, patient gets injured, they then come to your office. What are some of the modalities that you perform?
Well, initially, like I said, after you're doing the orthopedic and the neurological evaluations to make sure they are able to undergo or undertake some of those procedures that we have to do, such as physical therapeutic procedures. We can do range of motion exercises, strengthening exercises. That's definitely not in the beginning. That's as they are beginning to rehabilitate and their inflammatory stage has come down somewhat. And that's with the help, again, with some pain management specialist or some type of interventional pain injectionist that we can use for pain control. At the same time, we can proceed on to doing more active exercises, exercises to help strengthen and build the muscle, and at the same time get the range of motion in the joints back to the way it should be.
So what is the difference between a chiropractic physician, if a patient gets sent to you, versus if the patient was sent by their doctor, workman's comp, to a physical therapist, for instance?
Our discipline, like I said, we come in with an approach that's fully, it's a full court press. We present the patient with all the options that they have, from chiropractic therapy, which involves the manipulation and the mobilization of the spinal segments to help the patient, especially with the spinal injury, to go ahead and manipulate the spine, align the spine to make it work at its most, at the utmost level that it can work. And we also do physical therapeutic modalities, which we also cross-refer to physical therapists in our practice to make sure the patient, whatever the patient needs, the patient has to get.
So if a patient comes to you in your practice and they show up at the door, just explain to us, what is the typical day like for that patient? What do they do?
Of course, doctor. The patient would come in. We'll do a consultation. We'll find out exactly what is going on with the patient, what kind of injuries, what is the best procedure to go by as far as diagnostics. Have they had diagnostics? Have they been to the emergency room as of yet? If not, then diagnostics have to be ordered. When I say diagnostics, we mean maybe x-rays, maybe MRI, maybe CT scan. And also to get other specialists involved if the need arises.
Today I'm here with Samuel Pond, Managing Partner of Pond, Lahaki, Stern, and Giordano, member and past president of the Philadelphia Trial Lawyers. Thanks for coming today.
Oh, it's my pleasure to be here.
So today we're going to be talking about a couple of things today, primarily workman's comp or workers' comp. So when someone gets injured, can you just go through with us what should someone do?
Yeah, it's very important at the very beginning when someone's injured that they, number one, give notice of their injury to their employer. So if they're injured and they're on a construction site, they go to the supervisor and they let them know that they've been injured. That's required by law. The second thing that's extremely important is, despite what the employer's saying, they have to understand that they're really in the control seat here, or an insurance company, and that they control their situation and their destiny as far as how the workers' compensation injury is going to go and whether or not they're going to get the benefits by getting a doctor in their corner. To go see a doctor that is going to be very objective and healing and care about them. That's the most important thing, to go see a doctor of your own choosing.
Now, what is your role at your firm with the doctors? How does that work?
At our firm, if someone were to contact us for a free consultation and advice as to what their rights are under the Workers' Compensation Act, we have a whole medical team, and we would, if they needed to see a doctor, we would refer them to a physician to get the necessary treatment, bill the insurance company, get a diagnosis, and then going forward get a course of treatments, and hopefully they can recover. So that's what happens with our firm as far as getting the medical. In Pennsylvania, anyone that's injured on the job, and this is going to sound self-serving, but it's clear because there's no fee, they should see an attorney to give them advice. With Google and all the ability to get information off the internet, you can punch that attorney's name into the system, into the internet, get their qualifications, understanding what they're about, and make sure that they have a specialty in workers' comp. You wouldn't go to a chiropractor if you had a cardiac condition. You go to a cardiologist, board certified, great qualifications, experience, staff, team, resources, that type of thing. And an attorney cannot charge them for a free consultation, and they cannot charge them unless they're successful in actually going into court and getting their benefits. But at least go in, get a diagnosis, know what your rights are, and then move forward. You'll sleep better at night and you'll be protected.
What are some of the things that clients come to you that they are concerned about?
They're concerned about quite a few things. Number one, what are they going to get paid under workers' comp? And generally it's 2/3 of what their average gross salary was. They're going to want to know when they're going to be paid. They're going to want to know how long are going to be able to get paid. They're going to have a lot of uncertainty. They're going to wonder, how am I going to deal with my anxiety? Can I see a doctor for that? What happens if I do go back to work? Do I have rights? What should I sign? What shouldn't I sign? Should I apply for short-term disability while I'm waiting for my workers' comp? Should I get unemployment benefits while I'm waiting for my workers' comp? There's a whole myriad of issues and a lot of different things that are going on. Get people in their office, take a deep breath, spend an hour with them, calm them down, let them know what they're doing so they can make reasoned decisions, and then get a strategy going forward.
So would you say that with each client, it's completely individualized?
I have been doing this for 30 years, and I haven't seen two situations that are the same. Everyone's life is different. We have a different injury. We have a different age of the person. They have a spouse. They don't have a spouse. They own their home. They have children. There's a lot of things going on. You've been in the union for 15 years. You just started a new job. There is so many things that are going on. So each case is individual, has to be treated individually. And then hopefully people are going to have the trust and confidence to give us that ability to give them counsel and advice so they can move forward.
Let's talk about time frame. How long does something like this go on for?
That's a really good question. It's a question that people want to know, obviously, because that's what they're worried. When am I going to get the check? Under the law, an employer or an insurance company have 21 days to make a decision as to whether or not they're going to accept or deny a work injury. If they deny it, we have to go in court. It could take 9 months to get someone benefits. If they get benefits in that 21 days, they could get those benefits theoretically for the rest of their life. But the important thing is that 21-day period for the insurance company to make a decision as to whether or not they're going to accept the claim or not. And whether or not they're going to accept the claim or not is really what's the medical saying. What does the medical say? What are the facts? So we want to make sure that that's all very well done, presented in a cogent way.
What if a worker is not able to get legal advice?
Well, every worker is able to get legal advice. They have a constitutional right to see a lawyer and to get counsel as to what their rights are under the Pennsylvania Workers' Compensation Act. So that's there. And again, I want to make it very clear to your audience, it's very important, that there is no fee. The consultation's free. If someone's going to charge you something to have that consultation, see another lawyer, get that counsel, get some peace of mind.
Now, are the laws different in Pennsylvania as compared to other states?
Very good question, because we have a lot of folks that come in from Jersey, that live in Jersey, that get injured in Pennsylvania. All 50 states in the United States have different workers' compensation schemes. All these systems came around, and I don't want to get too far afield here, I know our time's limited, about the turn of the century. And everyone gave up a constitutional right to sue for damages under the 11th Amendment to get workers' comp. But every system is different. New Jersey's workers' compensation system is much different than Pennsylvania's. Generally speaking, Pennsylvania's, you're going to have better rights as an injured worker in Pennsylvania than New Jersey.
Now, if you get injured in Jersey, do you need to have a lawyer from New Jersey, or does it matter?
Good question. General rule, if you get injured in Jersey, you're probably going to need a Jersey attorney that does New Jersey workers' comp. However, if you were hired in Pennsylvania and you did work in Pennsylvania and got injured in Jersey, Pennsylvania may have jurisdiction.
Great. Is there any role in the public at large that can play in shaping the workman comp rules?
Very much so. We've had a lot of what I would say regressive, if not draconian, changes to the law in the last 20 years. The insurance industry and the Chamber of Commerce and big business is trying to, again, limit rights now. There's talk of changing the laws even more. People have to be very politically active. Contact your state rep, contact your state senator, and tell them you want a progressive, pro-injured worker body of law.
If there's one thing the audience needs to get out of this, what is the main objective?
If I had to choose one thing, it's to understand that you have a lot of rights and you can control and you have power. Don't feel powerless. Understand that you have rights. Go get counsel, get advice, but you do have rights. You're in the driver's seat, and once you believe you're in the driver's seat, good things will happen to you in regard to having a work injury. A horrible situation can be turned around and you'll come out okay.
Great.
When was the last time you had a checkup?
So it's a combination of surgical and non-surgical practice.
Featuring doctors and health news from your very own neighborhood. Philadelphia has numerous public health centers around the city, informing the local community about fitness and food, treatments and technology, diseases and diagnosis, signs and symptoms, promoting a healthy lifestyle. Are you taking the healthful advantages of fruits and vegetables? Let's take the 5 a day for a better health challenge. Throughout the Delaware Valley, HealthTimeTV is reporting about real patient experiences and accessible local doctors.
You have to think of the body as being a well-engineered system where everything works together.
Tune in for health tips, viewer mail, medical mythbusters, and innovative therapies.
Then switch the hand position to fingers downward, forearms still parallel to the ground. Well, Joe, I look forward to seeing you in the office. And remember, whenever you go to me or any other healthcare professional, you want to let them know what your concerns are.
HealthTimeTV features one-on-one interviews with specialists.
You can go to that nerve and put the medication.
Watch experts discuss new procedures and patient success stories, all from the Philadelphia region. Visit us at HealthTimeTV.com to watch online episodes, check our health blog, or email our medical experts your questions.
Hi, welcome to Health Time TV. I'm Dr. David Targan. Today we have Dr. Sanjay Gupta. He is a Harvard-trained pain management specialist in Philadelphia. He is the president of the American Pain Association and the director of the Mainline Pain Management. Dr. Gupta, congratulations for being nominated as the top doc in pain management by the Philadelphia Magazine.
Thank you, David.
What exactly is pain management?
Pain management basically is a new field in medicine which deals with variety of pain problems, including back pain, neck pain, cancer pain, nerve pain. So it's a fairly large spectrum of pain problems which we deal with. And there are a lot of new techniques which are available now which can avoid the need of surgery. So that's what pain management is all about.
Okay. Tell us a little bit about your training to become involved in pain management.
I am a board certified anesthesiologist and also a board certified in pain management. So after finishing my training in anesthesia, I did further training in pain management, and it required a fellowship training where we learn all the procedures, all the new advances in pain management. So this is what the training was.
Okay, great. Where is your practice located?
We have practice in Philadelphia and also in Philadelphia suburbs, including Bala-Cynwyd, Paoli, and various locations in Philadelphia. And also we have some locations in South Jersey.
Great. A lot of people have back and neck issues. What are some common causes?
Well, as you know, back and neck is a very common problem. In America, almost 1 out of every 8 adults have some kind of a back or neck pain. And it involves people of all ages. It can be, young people, old people, so it's a very common problem. Now, the most common cause, I will say, is the disc problem in the back. In the spine, whether it's cervical spine, which means neck, or the lumbar spine, which means low back, we have several discs which acts like cushion. And I can show you here that, as you can see on this model, this is the spine. Here you see the low back, and this is the neck area. And between the bones, you see this cushion, which is called the discs. So what happens in back pain, one of the most common causes is the discs get damaged. So the cushion between the bones get damaged, and that causes back pain many a time. Sometimes the disc can come out, and that, as you know, it's called disc herniation in a layman term, and that can also cause the back pain. That is the back pain which usually goes down the leg.
Right, and that's something that when I see my patients and they're having back pain, I tell them it's like a jelly donut. That if you push a jelly donut, the jelly is actually the disc, and it herniates and puts pressure onto the nerve. Is that correct?
That is a very good way to explain the problem. Now, the other cause of back pain is the joints in the back. Basically, these are the small joints, as you can see them here. These are called facet joints. And whenever people have back pain, which is dull and aching and not going down the leg, that is usually because of these joints. And there is also another joints which is called sacroiliac joint. These are the big joints in pelvis bone that can also cause back pain. The fourth cause is the nerves. These are the nerves which is also called sciatic nerve in the layman term, which can also cause back pain going down the leg. So these are some of the common causes of back and neck pain.
Can you describe some of the treatments for these common modalities that we're talking about here?
So the treatment, basically, it depends upon the cause of the pain, and what we try to do is find out what is the cause first. Whenever a patient comes to us, we see if pain is coming from the discs or nerves, and so that is first establishing a diagnosis on these patients. We get studies done, including X-rays and MRI.